Hello. Yeah, I'm just commenting on a young lady, Jodie Ann Fearon. She died after they deny her medical care at various hospitals, various public and private hospitals, saying that she's showing symptoms of COVID-19. So they took her out of the hospital and find all sort of excuse for her until she died. And they had to do a C-section for birth. So literally the hospitals claiming she has shown symptoms of COVID-19, deny her health care and she died. No, the same hospital had somebody from Turk and Caicos Island that was confirmed case of COVID-19, and the same hospital treat that person. But the local people, they're talking about oh, she's showing symptoms. So what happened if any normal, suppose like 1,000 people, 2,000 people have it, what are they gonna do? Obviously they're gonna turn them down. Obviously they're gonna turn them away. Obviously they're not gonna help you. Listen, if the administrators of any one of these hospitals, like I'm not talking about the private hospital, but even public hospitals, if administrator come to the public and says, you know what, these type of stuff, we're not going to turn away anybody and whatever, and show the public that they even care about people, that could be translated in, do you know that there every few years nurses go on strike, telling the government, oh, they want more money and they want more pay and they're not paying them enough. I mean, if some of these people obviously show the people that they really care about them, do not turn away anybody or whatever, do not leave people unattended and leave them to die, the public would be behind you having your increase in salary. You wouldn't have to even worry about it. But you treat people like this. People be experiencing stuff like this where you let them die because they're pregnant and you're talking about she's showing symptoms of COVID-19 when it wouldn't be her fault. And when they did test her, guess what happened? She didn't have COVID-19. So they let this person die, 23-year-old. She just graduated from university last year, and they let her die, talking about she's pregnant. She go to the hospital for help. They let her die, talking about she's showing signs of COVID-19 and they're not equipped for it. When this person from Turk and Caicos Island came in, had COVID-19, confirmed case of COVID-19, and they treated this person. I don't understand. The government of Jamaica is the same thing. The government of Jamaica, a lot of Jamaicans are abroad. Would make a lot of effort to help the country if the government of Jamaica didn't treat the people like this. The government of Jamaica would leave you abroad, don't help you, don't do anything, and or treat you bad in the local country or whatever, and just like any absentee father or whatever, the people doesn't feel any connection to them. The people, nobody, you have one or two people they love the country and they're not caring about government, whatever. But overall, a lot of people don't even look back and say, oh, let's help or let's do this, because the government of Jamaica doesn't treat the people right. Everything that these people are doing, if the public hospital came out with the ministry and talking about they're equipped to deal with any COVID case, I know the reason why they said it. I know what's going on. I think the government of Jamaica is in the IMF, and the IMF tells you that you can't spend any money even during a crisis, right? You don't think the IMF has something to do with this also? If the public hospitals need more gowns, need more ventilators, need more money into an emergency, as a country you must have emergency care, as emergency spending. you're supposed to be able to order enough equipment to give any public hospital, and they're supposed to be able to handle enough people, any amount of people that they want to handle. The IMF tells the government that they can't spend anything. The government is still in the IMF, and that's one of the issues also. They're lying to you. They're lying to you. They just come publicly and tell you that, oh, we're prepared. But as soon as something happens, they're not doing anything. But the writing was on the wall like a few weeks ago. There was a doctor who was showing symptoms of COVID-19, and the hospital turned him away also. So this is a cultural thing. And it's not a good culture at all. This is pure corruption. People shouldn't stand for this. No hospital should turn you away. If there's no way you're in a job, talking about you're afraid. It's like the police that's supposed to protect you from society. They're afraid to confront the criminal. If you're in a hospital setting, you don't want to get sick and die. You don't want to bring home stuff to your family. Yes, but you're supposed to have enough the gear to protect you. You're supposed to have at least different wards set up. Even though the United States started out slow, even though they have a lot of deaths, at least you could say they were building mobile beds. They were building mobile getting enough space to put more and more patients. These hospitals they're not doing anything. They're lying. They're obviously lying. They went on to say that they had, one of the public hospitals says they have 2 people already with COVID they're treating, so they can't take anymore. Do you understand the meaning of so what? If 10 pregnant women came to the hospital and they have COVID, they're just gonna let them die? Yes, that's what they're gonna do. Obviously, that's what they're gonna do, because that's what they did. It's not only this lady that died. There's a previous pregnant lady that died. 2. These people are not taking care of the people. These people, they're in the IMF. The IMF tells them they can't spend any money on anything. Now they're going back to the IMF again, to repeat the same thing. The public hospitals, through the ministry, they're pretending like they're spending the money. They're not spending any money. You're supposed to have emergency spending. Take $500 million US dollars from the emergency import. You have over 3 billion. Take 500 million, form a bank with CARICOM. Borrow about the money at 0.1% because you're a member of that bank. You help form the bank, and use the money to build new hospital capacity and stuff. Small business loans and roads and whatever you're going to use it for. Whatever you're going to use it for, and then limit the import by 500 million US dollars. The government of Jamaica isn't thinking smart. They're not doing anything. They're being held by the IMF. Obviously, they're in the IMF, and the IMF tells them they can't spend anything. There's no way in hell you tell me that you're all the ministry talking about all the hospitals are equipped to handle this COVID stuff. But as soon as there's a crisis, we can't take it, or we're afraid to take it, or we're not going to take it, or whatever. Obviously, something's wrong with the system. Obviously, the administrators are lying. The government is lying. The IMF is involved, and is not a good situation at all. And obviously, a lot of reform has to take place for this not to happen. And there's supposed to be a law. They're supposed to pass a law that's mandate that no hospital cannot turn away any citizen from treatment, and the government must have emergency funding for hospitals. So if the hospital send the government a bill and says that we need this amount of equipment, they need to get the equipment. These people are lying. They are lying and they're lying and they're lying. This is what happens when you're in a country that isn't pursuing development. You need to can manufacture ventilators. You need to can manufacture medicine. You need to can do a lot of stuff that you need to can manufacture even the tests. The African country of Senegal, they manufacture their own COVID tests. They said the reason why and their tests they say is reliable. It's not like the one from China that they say doesn't work a lot of the time, because they said that they participated in the Ebola outbreak and they used that knowledge to develop the COVID test, and their test works. The notion that the Jamaica should run like this is ridiculous. And the government's at fault. Some of the people are at fault. I mean, how can you run a hospital like that? They're lying. Obviously, IMF is involved. As soon as you have the public hospital saying that they don't have any space, and only two beds and 2 people with COVID. So what about the rest of the people? How about the government limit import by $500 million and spend $500 million on the import on the reserve, and open a bank of the CARICOM and borrow that money at 0.1% and do the stuff they need to do. A country cannot be run like this. And obviously this lady that died, she was only a university graduate. She worked for the government too, and they're treating her like that. A lot of people here don't have a chance to live because of the way how the system. This man come on the radio and said, this talk show host said that you got to fight against the system to make it. Obviously, they are proving it right. Obviously, the system, the system set up where you got to fight against it to make it, and the system is just self-hatred. A lot of people you're fighting is the same people. The same people, but I guess they are indoctrinated to hate each other. So, damn, they're not gonna treat you. They're gonna let you die. But they shouldn't have that choice. If you're in the hospital, you know you're gonna deal with sick people. So, the hospital, the administrator for the public hospital should come out to the Jamaican people and says, okay, if you need us to be able to treat enough people for COVID, we need this amount of millions of dollars to buy equipment and stuff. They need to come out and tell us that. They need to say, well, an extra $50 million, we can do this and we can do that. All the hospitals need to do that for this emergency. And I think the hospitals are in collusion with the ministry, with the health ministry, and with the IMF, and they're bullshitting people. They're bullshitting people. They're not spending nothing. They come in public and 3 weeks ago and say, oh, we're equipped to deal with any case. And as soon as there's a pregnant lady who didn't have COVID-19, but they're claiming she has shown symptoms of COVID-19, they turn her away and deny care and let her die. 23-year-old woman. University graduated last year, looking forward to being a mother, work for the government, and yet they turn her away from 3 different hospitals. They didn't treat her and they let her die. The government is lying. They're in collusion with IMF. The Ministry of Health is lying, and the administrators for the hospitals are lying. And all of them, there's some bureaucratic people. They're not spending anything. They need to break ranks. The administrator for the public hospital need to break ranks and said to the people, put out a letter that says that we need $60 million in funding, or 50 million, whatever million in funding to equip the hospital with stuff, from equipment to ventilators to whatever. Obviously they're lying. Obviously that's why the people are like that. How you're gonna find that the hospital be saying, oh, we need more equipment in the future, or we need more pay raise in the future, and yet they treat it like that, where they, as soon as there's a crisis, they're afraid to treat you. They don't treat you. When there's a foreigner from Turks and Caicos Island, they treat them even with that disease, even with COVID-19, they treat the foreigner anyway. But the lady, she's pregnant, they let her die, talking about she's showing symptoms, and when they test her, she didn't have it. Obviously, Jamaica needs to change. Obviously, there need to be policy put in place, literal policy put in place to reform, and obviously there should be some criminal liability and some lawsuit liability for these hospitals and people. And I can tell you, I'm going to end on this note. I know the ministry is involved. They're not funding the hospital. I know the IMF is involved. They said you can't spend any more money. I know the administrator of the public hospital is involved. I know they're in collusion. That's how they operate. They're in collusion. All three entities, they're in collusion, and they're lying to you, talking about they can deal with any. If local people come in, they can do any COVID-19. That's why the problem is that says stay home. But I didn't realize that staying home means stay home because we're not going to treat you, we're going to let you die. It should be stay home, not to spread it around. But if you get in trouble, we're going to treat you. And it's a hard lesson to find that if it happened to her, it can happen to you, it can happen to me, and anybody else around. And shame on the people, shame on hospital people, and is criminal liability they did. I hope they get sued. I hope there's a criminal probe. Some people need to go to prison, and I know the ministry is involved, the IMF is involved, and the administrator for the hospital is involved, and they're in collusion. They're lying to the people. The government is not spending any money, The government is not spending any money to equip the hospital. You shouldn't, a month, 3, 4, 5 months in the crisis, whatever month in crisis, only have 2 beds available with 2 person you're treating for a public hospital. They should have the capacity to have mobile beds. They should have the capacity to have emergency stuff to buy. They're not doing anything. That's what happens when you don't manufacture your own thing. You got to import it. So obviously there need to be structural reform for the country. And I'm going to end on a note. This collusion need to end with the IMF, the public health ministry, and the administration for the public hospital. I'm signing off.